thank you for taking the time out this evening. I think that we have a lot of good things in store. I'm excited. This is our March town hall, and it's been a very busy week. I want to give you an update on really what's happening. So if we don't get to your questions, we will respond via email. And of course, you're welcome to call our office anytime. But there are so many questions, and we're trying to respond in real time, but it's so rapid fire. But first, I want to respond to a question that many have asked me every day. They call our offices when I'm in the store, when I'm downtown, when I'm on the south side, north side, west side, east side. What can I do? What can we do? Well, one of the things that we can do is exactly this: coming together on a Thursday evening to fight a very dangerous administration. You know, this isn't a step-by-step playbook on how to combat fascism, right? This isn't a playbook on how to deal with this unprecedented constitutional crisis. But we can look at our history, our country's history, our world's history. We have always had periods in our past, but we have also always had brave individuals who have fought back against injustice. We had it then, we have it now. You are the resistance. We are the resistance. So I'm going to start by talking about the specific ways that I am resisting and we're resisting. Firstly, we're fighting misinformation with accurate information and with oversight by communicating and shining spotlights to the illegal actions demanding accountability. We're fighting targeted legislation, and we're fighting with litigation. We're using the courts to act as a check and a balance that the founding fathers really envisioned. So let me share a few details about our efforts. First, Democrats, we've evolved. We've learned from the things we did not get right. We're actively changing our messaging strategy to more clearly let people know how hard we're working to fight for our constituents. I have to give my Republican friends credit. They're very clear and concise when it comes to their messaging. 3 or 4 points, and they hammer on those points repeatedly, and they make it clear for people to understand. Democrats, admittedly, we're very esoteric. We talk about subsection 4.1. No one cares, right? But there's no question that Democrats have had to seriously reassess our strategy after November. And clearly, our message was not resonating with the American people. I'm one of the many members and founding members of the Heartland Caucus, which is a new caucus of Midwestern Democrats with Midwestern sensibilities. And the truth is, the party needs to listen to Midwestern voices, not just our brothers and sisters on the coasts, but the Midwest, Southern brothers and sisters. We need to evolve the party, and we are evolving. We're changing our digital strategy. Democrats have to compete with the onslaught of misinformation and lies that extremists are putting out every day. There is an army of influencers, MAGA influencers on social media who are following President Trump's playbook, and they're spreading his lies. But we're pushing back with engaging digital content that is truthful, that is impactful, and I hope you'll engage with us as well. And we wanted to make this very interactive. And Democrats, we're calling out hypocrisy at every turn, and we're keeping up the pressure to get answers, to get accountability, to get the Trump administration to reverse very dangerous policies. So we have to present our message to the American people and let the American people know that we're fighting for hardworking families. We've had enough. Folks are disappointed. They're pissed off, pardon me, as they should be. So am I. The party is working to represent the working class. The party that invented Social Security. Social Security. We're the party that fought for lower cost and for equal opportunity for all Americans. And secondly, we are fighting the Trump administration legislatively. You know, we are introducing legislation like the Taxpayer Data Protection Act to keep your and my data safe from Mr. Musk. We're introducing the Aliens Not Enemies Act, which would effectively repeal one of the dangerous, outdated laws that the president is using for mass deportation. And unfortunately, Democrats in Congress do not have the majority. It's simple. And to pass a bill in this Congress, we need bipartisan support. The many bills that I've had passed since I've been in office were done with bipartisan support. Friends on the other side of the aisle thinking like we do. A few of those bills were signed by President Trump. And, you know, with one of the thinnest majorities in congressional history, quite frankly, we only need a handful of responsible Republicans to vote for their constituents' interests instead of being afraid to vote against President Trump and Mr. Musk's dangerous orders. And, you know, I've experienced the Trump administration before, was able to get bills passed. And I will absolutely do everything I can to pass bills, even in this administration, and to advance legislation to protect democracy in everyday America. So we're always going to fight for lower costs. We will always be fighting to strengthen Medicare, Medicaid, Social Security. And I'm fighting to keep our country safe. I'm fighting to fix more funding to fix our roads and sidewalks. We brought back hundreds of millions to Indiana, Indianapolis in particular. And Democrats are united by voting against harmful, dangerous bills. But we need your help. We need your advocacy. We need you on the ground. We are the resistance. We have to push back on any funding that fails to protect Medicare, Medicaid, and of course, Social Security. So we're not wavering. We will not vote for any of these MAGA bills, period. Republicans are going to need Democratic support too. They can only afford to lose 5 votes, just 5. That's not a lot of votes. And there are already cracks forming in their party, and it's getting harder and harder really to defend President Trump in parts of Indiana, in parts across the country, especially with the signal controversy. And finally, the third part of our strategy is that we are fighting Donald Trump in the courts. We have a Democratic litigation working group, which is continuing to really work to ensure that the rule of law is upheld. The court landscape is really constantly changing, but we have seen victories. Judges have ruled to protect birthright citizenship and protect federal workers. And I'm supporting these legal efforts with our friends in Congress, and we're using the courts to do so. So we're gonna continue to push back on any baseless effort by far right extremists to impeach federal judges who rule against unconstitutional and really unlawful executive orders. And lastly, we want to push back against the misuse of immigration or law enforcement to arrest protesters. We just saw the young lady who was arrested. We just saw the young man who was taken from his pregnant wife and detained down south. We're going to push against those harmful actions, and we're going to keep fighting.
Thank you so much, Congressman. I believe we have as well, Dr. Caine is going to join us to give some updates as well. Dr. Caine?
Good afternoon, evening, everyone. I'm so delighted to have this honor at an invitation of our Representative Carson to bring news from the DC area. I am the current 125th president of the National Medical Association. This is the oldest Black physician group, though we take every race as a physician, representing over 50,000 physicians and their patients. And so we're having our health policy meeting kicking off tomorrow. So we're very excited about that, but I have some very concerning information out here. Just 2 days ago, we received a letter as director of the health department in Indianapolis at 9:30 p.m. in the evening that our immunization program was being eliminated immediately. And so when we think about the measles outbreak happening in Texas, where they started out with just like 24 some cases, they're now up to 327 cases. And unfortunately, we've had 2 deaths, a young child under the age of 12 and an adult died related to this measles outbreak. But it's a very extremely contagious viral condition, primarily attacking children between the ages of 5 and 17. And you can have a meningitis, inflammation of the brain, as well as pneumonia. But we are now seeing that they've cut all state and local health departments' budgets by $13.1 billion. And so some places like Chicago has lost $153 million from their programs. And so we have to be very concerned about our ability to protect the public. Now, just today, we got an announcement that the Health and Human Services, better known as HRSA, is having 10,000 employees terminated. And they had already received resignations from 10,000 other employees. So that's a total of 20,000 employees we're losing from the Health and Human Services. And that's 25% of the workforce for HRSA is literally gone, 25%. And so that primarily oversees the Food and Drug Administration, FDA. It helps to oversee the Centers for Disease Control and Prevention. And we are also knowing that it's impacting and oversees SAMHSA. That's a substance abuse agency that deals with all disorders related to substance abuse. And so when we have this fentanyl epidemic with overdoses, we have the bird flu taking place across this country. We have to be concerned, do we have the workforce to come out to meet these demands and address these issues that are occurring? But probably the most serious thing I want all of us to think about is how critical it is for us to have our Medicaid programs for our patients, individuals. Indiana, if we should have a major cutback from the federal government in regard to Medicaid cuts, that can have huge implications for Indiana's Medicaid program. And if we should drastically cut those funds or decrease their eligibility, women and children won't have access to health care besides our males. So our pregnant mothers may not have the ability to receive prenatal care. Our children, if they're having an asthma attack or ear infections or things of those nature, we may not have access. So we've got to protect these programs. And without these programs, we can't do preventative care. How is it if you have a patient that's got high blood pressure and they can't afford to pay the medications? What'll happen? They may have a heart attack or they may have a stroke. Do we want to see that when it's simple to just be able to take your medicines every month? Are those diabetes patients? They don't want to have a diabetic foot infection and then next thing you know, they have an amputation, or they can develop kidney failure where they now have to be on lifelong dialysis. And so we have got to fight for the right to protect our communities, any disadvantaged populations, vulnerable populations. We need to do that because I know You have colleagues out there. I know you have family members out there. And so there's a lot that we can be doing, but we have to hear your voice. And so I have 300 employees that are on grant dollars at the Marion County Public Health Department in Indianapolis. And so I have to be concerned, if grant dollars are eliminated, what happens to those positions? And those positions are at the value of $23 million. But please, it's important when you go out to eat at a restaurant, we protect you with our inspections. The water that you drink is critical. And so we have so many different critical public health programs that it is really crucial. But also know in a lot of smaller rural communities, especially in the state of Indiana, sometimes there may not be a hospital 100 miles away. They need to have access to those services. And when we look at our Medicaid program overall in this nation, 44% of Medicaid recipients are white. Only 19% of Blacks are recipients of Medicaid. But it's critical. Our Affordable Care Act is really critical. Help us in the fight to do the right thing. And again, Representative Carson, just thank you. I want to thank you for your leadership, all the work that you're doing. We know that there's some financial consequences that we have to address, but I think we can do it in a thoughtful manner, do it in a correct manner, appropriate manner, where we're not causing any unintended harm, unintended consequences, and also the possibility that our financial costs may go off the charts if we don't do it correctly.
No, thank you, Dr. Caine. It's always good to hear your insights. Thank you for what you've done for not just Marion County and Indianapolis. Thank you for what you've done for the state and now our entire country. We need these updates. I just met with a group of folks from FDA, and they had received emails, termination emails effectively. Many of these researchers were called back to work. These cuts, there was another announcement just made about the government letting off tens of thousands of federal employees. These DOGE cuts cannot be made simply by using AI or software. These are human issues. The government is not a business. And I think when it comes to our healthcare, we have to be more thoughtful. We are the wealthiest nation in recorded history. And these are issues that impact everyday Americans in a very real sense. So I want to thank you, Dr. Caine, for what you do and for what you've done, because without your dedication, we wouldn't be here and we wouldn't have advocates and voices in your space to allow us to make informed decisions when we vote. So thank you.
Can I just give you one last message?
Yes, ma'am.
Parents, get your children immunized. That's so critical because we're just a plane ride away. So I really want to encourage you to do your measles vaccinations and do that appropriately. And so if you can do that one small factor, I think that's very important. I also know that there's some great medications out there new. That's why we need the FDA, because they do the research to know whether these medications are safe. We've heard that you should be taking vitamin A for measles, but we're seeing that there's now some toxicity because parents are giving their children too much vitamin A and it is causing some kidney damage. So don't replace the treatment for measles with vitamin A. It can be a supplement, but it is not the appropriate treatment to prevent measles. But think about going after in supporting some of these weight loss medications that can reduce heart attacks by 30%, strokes by 7%, and talk to your policymakers. Talk to André. Tell him what your concerns are. Thank you so much.
Thank you, Dr. Caine.
Thank you so much, Dr. Caine. Dr. Caine is the Director and Chief Medical Officer of the Marion County Public Health Department. So I want to thank her for joining us. We have some great questions that are in the chat. The chat is definitely filled with
Mhm.
some very pertinent questions. So we want to go ahead. Allison asked a very important question, Congressman. It's been a very heavy week in the news. Of course, we've all seen what's been going on with Signal. So can you talk to us a little bit about Signalgate, and do you have any updates on what the fallout was that was happening this week?
Yeah, so we held a hearing yesterday with the House Intelligence Committee, speaking to leaders in the IC, or the intelligence community, about this very issue, and it's an issue that's close to heart. The question becomes, how many other signal chats have already happened or are happening now, exposing our national security secrets to our enemies? We cannot give anyone a pass or the benefit of the doubt when it comes to our national security. These are American lives on the line. Yesterday, I questioned our nation's top national security advisors, from the FBI director to the head of ODNI, about this issue. And, we've been warning about the dangers of hiring certain individuals to run our government, particularly in the national security space. There has to be, and there must be, consequences for the very egregious mishandling of military operations and plans by the nation's highest national security officers. That's why I have joined my colleagues in calling on Secretary Hexet to be reconsidered. And it's not just a breach of security, but the cover-up is what made it worse. We all make mistakes, we know this, but any national security expert will tell you the details in that chat fit the description of, or the definition of, a very classified exchange. And the law was broken when they shared these details on a very unsecured, open commercial platform. We're being gaslit. They are lying. This is a national security threat. They know it. We know it. Republicans know it. And we aren't letting Donald Trump off the hook. We are confronting this administration with the truth. We're confronting this administration with facts. And we are confronting this administration by exposing their tactics. Thank you, Jackie Needus. Thank you, Ashley Gerbitz. Thank you.
Thank you for
Terry.
that. Thank you for answering that, Congressman. We've gotten a few questions about the Minton K Park building.
Yes.
So can you talk a little bit about what's happening to DFAS and the Minton K Park building right there in your district?
Yes, sir. Well, DOGE put the Minton Capehart building and the major Emmett Bean Center on a list of federal assets to be sold. The Bean Center houses DFAS, which is the Defense Finance and Accounting Service, which provides paychecks for our service members. Paying our courageous service members, it's not optional. It even provides President Trump's paycheck there, right in Indianapolis, right here. And so maybe that will make him reconsider. The Minton Capehart building houses Social Security and VA offices, plus 6 immigration courts. So I strongly object to this very short-sighted plan. I'm working to save these federal buildings and the services they provide. DOGE has since removed their original list from their website, but they've not abandoned their plans. I think it's very important to know. They've just hidden their plans. So there's no transparency. And there is a lot that is deliberately unclear. Folks receiving Social Security in Indianapolis tell me the Minton Capehart building is very essential to receive in-person services. Closing it will effectively mean they will have no options or nearby services. There are many services that our caseworkers deal with, working with their caseworkers, that simply cannot be dealt with over the phone. They have to talk to caseworkers. And so Mr. Musk has been very clear on his thoughts about Social Security. He has called it a Ponzi scheme and an entitlement. Social Security beneficiaries work their entire lives for this money. It is their money. They deserve the money. Donald Trump promised he wouldn't touch Social Security, but he is. You know, my Republican colleagues insist these policies are not impacting Social Security, but they are. They're Republican constituents too. These are Hoosiers. These are Americans. So Democrats are sounding the alarm on the impact of Social Security. And, you know, as I said earlier, Republicans have one of the slimmest majorities in the House in 100 years. We only need 3 Republicans to stand up for what is right. And these are decisions that hurt every American, white, black, Republican, or Democrat. And, you know, Donald Trump tends to make decisions that he likes to backtrack on later, but it's political theater. They say the first 100 days of a president's administration define his or her legacy. It's not always substantive. These executive orders clearly are not enforceable, but it has created a lot of chaos and instability that is hurting communities. It's hurting urban centers. It's hurting rural communities. So I'm fighting for the Trump administration to reverse course. Our communities can't afford this. We're pushing for transparency. We're pushing for specific answers. That's what we are elected to do. You know, Mr. Musk was not elected. He does not represent the people. I think he's done a lot with with Tesla. I think it's a fantastic car. It's an American automaker. But in the governmental space, these problems cannot be solved through AI or software. This administration is hiding from accountability. But I'm going to keep pushing for answers. We were able to get these centers removed from the list, and we're going to keep pushing for transparency. But before we move to the next question, can we talk more about efficiency, since many of the questions have involved cuts to federal funding from the workforce? Can I
Yes,
just okay, yeah. So, like many of you, I strongly support more efficiency in our government. We can always do a lot more to improve it. I'll be the first to admit it. But it's really important to point out that the role of government and the role of businesses are entirely different. Businesses are designed to make profits, to make as much money as possible, which is great for business owners and their employees too. But government is quite different. Government is defined to protect citizens, to keep us safe with laws and orders, with safety, with transportation, with regulation, food and health. Government is designed to provide a safety net for neighbors who need help, seniors, vets, the disabled, or the unemployed when they're out of work, or school lunches for kids. Marjorie Taylor Greene had the audacity to say that federal workers don't deserve their paychecks because they don't provide revenue. Now, how insane is that? How insane is that? They just consume taxpayer dollars. That's ridiculous, which makes this one of the most ignorant statements I've heard so far. So if Mr. Musk and DOGE really want to help, they first need to do some cost-benefit analysis. Look at all of the benefits of the services federal workers provide across the country and decide from there. I'm sorry.
We definitely appreciate that question about DOGE, or that response about DOGE. A couple of people are asking, you know, they know what's going on, they see the news, they know what's going on with the administration. We talked about DOGE and what they're doing. But some people are asking, what are you doing about federal funding cuts? Anything specifically that you were doing to combat these federal funding cuts?
Well, that's an important question. You know, I just joined my colleagues in demanding an accounting of all of the personnel freezes, hirings, and even terminations from federal funding for agencies across our government. Now, this includes getting details on these cuts and their negative impacts on the services agencies are directed by Congress to provide. Over the last several weeks, I've co-sponsored a number of bills and joined letters to restore agency funding, including grants and returning workers to jobs. This week, I'm leading 2 letters for my colleagues to join me in demanding restoration of terminated funding. The first letter fights to reverse the grant termination for the Fair Housing Center in Central Indiana. That's one of the 78 grants DOGE effectively terminated to stop fair housing enforcement, and it makes it harder to access safe housing. The second letter calls on the administration to restore funding to KIB, Keep Indianapolis Beautiful. They do a phenomenal job. Many of you have heard recently a portion of federal funding for KIB was terminated, likely because their grant included words like biodiversity. It's insane. It sounds almost too ridiculous to be true, but this is something I've heard from multiple recipients of federal funding. It appears that DOGE has been flagging words like diversity, equity, biodiversity, tree equity, which refers to the idea that all communities should have trees. We're carbon-based, we need oxygen, right? So my letter demands an answer, and it calls for the immediate restoration of these funds. And again, you cannot use software to solve these problems.
Thank you. We want to kind of stay on that topic a little bit with the cuts. We have Medicare, we have Medicaid, we have SNAP, Social Security. Many of these things, many of the constituents, many Hoosiers depend on and rely on. The administration has talked a lot about it. What can you say about those things, and what is happening to Medicaid and Medicare, Social Security and SNAP, and how will that how will those Hoosiers be impacted?
Well, I want to be clear. Many Republicans continue to put forward bills and funding packages that fail to protect Medicaid, that make cuts to veterans' health care, that fail to protect SNAP, Medicare, Social Security. I voted against a funding bill earlier this month for that very reason, because Hoosiers and Americans, we can't afford it. The cost of groceries is getting more expensive, despite promises that we've heard from the president. SNAP is a lifeline to countless families, not only in my district, but across the state of Indiana, across the country. Healthy eating is healthy eating is foundational. You know what? Indiana, the great state that I tout, that I love. People make fun of me across the country because I'm always talking about being a Hoosier, being from Indiana. Unfortunately, Indiana, the past few years, has led the country in food deserts. Healthy eating is foundation. It's core. So we can't expect children to be able to grow and function without that critical foundation. I'm also addressing a very serious issue in Indianapolis and across the country, which is called SNAP skimming. We've seen many reports that individuals using their SNAP benefits are being scammed and defrauded out of their benefits. And this continues to cause countless individuals harm, and it requires urgent action to prevent further damage. I have demanded that the Secretary of Agriculture provide me with answers by April the 8th. So if any of you are concerned, I need you to follow up, please, with the Agricultural Secretary and the Department of Ag to give us answers by April the 8th. We're asking questions like, how many SNAP beneficiaries have been victims of fraud? Which states have the highest incidence? What is being done to ensure those who are victims of fraud have their benefits returned? So if you can help us push, we need your help. And I've been meeting with Medicaid providers and beneficiaries like HealthNet. I was just there a few days ago on the South Side, who I met with last week. And I voted against funding bills that fail to protect Medicaid, Medicare. I'll do it again and again and again. And this is an issue that needs to join forces with other reps and senators. So we're telling people, call your senators, call your state house representatives. We have buddies in the General Assembly. A lot of the work that's being done in real time is happening on our city councils. It's happening in our state legislatures. It's happening on our school boards. Sound the alarm. We have to save Medicaid. So if you can reach out to your senators and your state house reps, they're with us. We have to sound the alarm. And we're also sharing stories, really to humanize this issue. We got to bring the heat. I know I'm controversial because I'm always pushing back on the administration, but we have to show that voting against Medicaid is voting against families. It's voting against our precious seniors. It's voting against people with disabilities. Medicaid is health care. Medicaid is health care, and health care is a human right. It certainly should be in the wealthiest nation in recorded history. That also goes for Social Security, by the way. Those are your benefits. They're your benefits. You worked for them, you earned them, you deserve them. MAGA says they won't cut Social Security, but their policies directly impact Social Security. So I'm going to hold them accountable. And Medicaid, Medicare, SNAP, Social Security, they are some of the country's most popular programs. Americans will not allow MAGA extremists to erase these lifelines. So if you're a beneficiary of Medicaid, Medicare, SNAP, or Social Security, or have questions, call our office, 317-283-6516, 317-283-6516, 317-283-6516. We also have an in-person exchange there in the office every month. Make sure you're subscribed to our newsletter, and we'll get the information to you. And any questions we can't answer tonight, we're going to email and communicate with you directly. That's how efficient we are. But call your other reps across the state. We're a delegation who is committed to helping Indiana. So we're here to work for you.
Thank you, Congressman. Kind of staying on that topic of cuts, we've seen, the administration, they may cut things without necessarily giving a replacement of something that they can help with. And we know Indiana is home to many great colleges, many great schools, and we saw last week where the president signed an executive order to remove the Department of Education. Can you just talk a little bit about the Department of Education, the impact that it has, and how it would impact Hoosiers with this if it was to be gone?
Yes, sir. So I kind of want to frame and break down what the president's executive order aims to do. The president effectively wants to eliminate the Department of Education, which he cannot do by executive order, because the department was effectively established by statute by Congress. So legally, only Congress can deauthorize the department. First, the president's order cuts Title I funding. Indianapolis schools rely on this funding. It's critical to hire and retain great teachers. Title I funding helps schools in very impoverished areas. It helps students who don't have the best advantages in life. And secondly, the president's executive order puts the student loan program at risk. It will make it harder to get loans like Pell Grant. And it exposes people to the private market of very predatory loans. And that's a whole nother issue. And thirdly, the executive order, it really guts civil rights enforcement from the Department of Education, which is required to enforce student civil rights. Discrimination based on race, still a problem in the US, as well as gender. And before cuts, the DOE was reviewing thousands of cases, including one where a Black student's request for additional disability services were denied. So there's no question we need the Department of Education, but the president cannot eliminate the DOE without congressional approval. And I strongly oppose any measure to eliminate or defund the Department of Education. I also strongly support litigation by the NAACP and the National Education Association, NEA, to block this very illegal move. And that's where I stand.
Thank you. Kind of changing topics a little bit. We've had a lot of questions that have come in about voting. And so, Could you clarify your stance on the SAVE Act? What is it, and what is your stance on that?
The SAVE Act stands for Safeguard American Voter Eligibility. And despite the title, the bill actually makes it much harder to vote and will effectively disenfranchise voters. I voted against the SAVE Act, I'm going to be honest, last Congress, and I'll oppose it again when it comes to the House floor in the next few weeks. The SAVE Act, it just makes it harder for people to vote, including married women, by imposing unreasonable requirements to improve your address. Who does it impact the most? Hardworking families who don't have time to wait in lines to update their voter registration. And these are very thinly veiled attempts to silence working people. I won't stand for it.
I appreciate that, plain and simple. We have one last question. We've seen the news. We have seen talking about deportations. Some students are nervous for their parents. Students are nervous for themselves. Seeing you out in the field working and talking, and some constituents have come up to you nervous. So can you address what you are doing? Some Hoosiers, right in your district, could be impacted. What are you doing to address these plain and simple unlawful deportations?
Well, I want to be clear. These deportations are very cruel. They're inhumane, and they deny due process, which every human should be guaranteed. I'm for safe borders, but these policies, they don't do anything to protect our borders. The administration is effectively detaining innocent people, and they're profiling Black and brown individuals. Our office held a Know Your Rights event in January. We're going to be holding another one. It's a webinar, April 16th. So we'll be empowering families with the tools they need to protect themselves, power of attorney issues, what immigration-related executive orders and lawsuits mean for you. People know Kathy. She's been waving the flag on this in our office. How to access legal resources. And this is meant for immigrant families, but anyone interested in learning more about how to support our neighbors during these tumultuous times is welcome to attend. And we're going to be pushing back with regard to unlawful arrest. We saw what happened with Shama and others who were protesters as it related to Gaza and other issues, and we want to protect First Amendment speech. We want to push back on discrimination. We want to push back on anti-Semitism. We want to push back on Islamophobia, anti-Blackness, anti-immigrant sentiment, sentiments toward the Latino population, anti-Asian sentiment. I sit on the China committee as well. And so we want to make sure that white brothers and sisters are protected as well. We live in a pluralistic and diverse society, but people should be able to express themselves. They should be able to express dissent without fear of harm or retribution.
Well, we definitely appreciative of you hosting another town hall. We know there are so many things that are going on, news cycle, things are
Immigrant
happening.
Welcome Center.
Yes.
Thank you, Jackie. Thank you, Jackie. Sorry, Ryan.
Yes, definitely. There's so many things that are happening, and definitely just appreciate you for staying engaged with the constituents. Do you have any final words before we wrap up?
I just want to thank each and every one of you. We're going to be doing a series of these. These are very tough times. They're very stressful times. I am here as your representative. One of the political questions that gets raised as it relates to policy and elected officials, is the person a trustee or are they a representative? And I think it's a combination of both. In one regard, I'm a trustee over Hoosier taxpayer interests. In another regard, I am a representative. I am here to represent you. I'm not in office to lord over you, to rule over you. I'm simply your representative. And I take that job very seriously. So I just want to thank you all. Hello, Miss Robbie. We want to talk real estate. So many of you have been asking about statewide discussions with myself and Congressman Mervan, who's doing a phenomenal job up north. We love Frank. He's doing a great job. I spoke to him earlier. We're going to try to work through that. I just spoke to a group of community leaders downtown Indianapolis, Robin Winston and a few other folks, hearing from folks. That was good. We've been having discussions. As many of you know, we in being very transparent, we've gotten some recent death threats at the office of people threatening to do harm, not only to me, but to the staff. And so we're very conscious of that. So I want to thank you all who took the time out on a Thursday night to come listen to us. We hear you. We've talked to you. I try to talk to everyone, as people know that we have a phenomenal staff. And I just love and appreciate all of you who join, no matter your political affiliation. If you're a Hoosier, if you're American, if you're a global citizen, we're here to help. So thank you, everybody.